Bravo 276 to gate.
Go ahead, Bravo 276.
Bravo 276 to gate. I don't feel well. I've got a temperature. Call medical.
Medical from security. Urgent message, over.
Control room, this is medical. Go ahead, over.
Reported medical emergency location 2, Bravo 71. Please attend, over.
Control room, this is medical. Copy 2B71. I'm on my way. Over and out.
Thank you, medical. Thank you. Over and out.
Rishad, can you hear me?
Do they have the blood pressure cuff in the white bag? Thank you. And can you give me the pulse oximeter?
Open your eyes. Okay, I'm going to give you some oxygen to allow you to breathe better.
Let me give you that. Could you just put that out of the way? Thanks, Remo. His blood pressure is 80/50.
Very good. What's the saturation now?
It's 90, and his pulse rate is 120.
Okay, Remo, can you call an ambulance, please?
Gate, from 2B71, we need ambulance service. Over.
Okay, Richard, we are going to give you some IV because you are a little dehydrated.
Which way out?
Let me show you. Come this way.
Let's look at the film. In particular, at 10 points to highlight differences between working in an office in a pandemic versus a non-pandemic situation. For a deeper look at some of these topics, review the chapters at the end of the film. 1. There are very few people in the office. During a pandemic, many staff will work from home to limit their exposure to the pandemic influenza virus. 2. Offices that have core staff members coming to work might arrange for transportation with shuttle van, but staff will be advised not to take public transportation. 3. Staff members have been trained on the use of surgical masks in a pandemic, how to put them on, take them off, and their utility. 4. Staff have been trained on how to clean their hands and to do so often. Public health experts have long maintained that hand washing is the single most important tool for preventing exposure to many infections, including the pandemic influenza. 5. Staff are screened for fever and flu symptoms before entering the building. During a pandemic, staff will take their temperatures twice a day. If they have a fever, they will stay home and inform the designated person in the office that they have a fever. 6. The traffic flow through the building is one way only, at least initially, to decrease the likelihood of spreading infection if staff members were to pass by each other. 7. Staff members have hand cleaner, masks, gloves, disinfectant wipes at their desk for easy access. 8. Staff members have radios and have been trained in how to use them. 9. Personal protective equipment is used by personnel who will be involved in certain patient care situations, or the transport of staff who are suspected of having influenza. 10. Offices will establish an emergency exit when possible for staff members that need to be transported to the hospital. Working outside of the office will present other situations that will require additional public health interventions. They will be addressed in the next of our film series of protective health measures for pandemic influenza.